Pharmacies are now looking for more workers after a hectic year of filling prescriptions and administering millions of COVID-19 vaccinations. A national study shows many pharmacies are experiencing personnel shortages.
That backs up reports of longer wait times at pharmacies across Hampton Roads. Investigative reporter Evan Watson explains the challenges pharmacists are facing.
It's been both exhilarating and exhausting.
Virginia pharmacies have administered 3.6 million COVID-19 vaccinations this year, more than medical practices and health departments combined. When added to filling prescriptions and patient care, pharmacy staff burnout was always possible.
Some of that's due to just frankly the increased demand and workload from point-of-care testing and from the COVID vaccinations.
Douglas Hoy is the CEO of the National Community Pharmacists Association, which represents more than 21,000 independent pharmacies across the country. The organization surveyed its members, finding 80% are having difficulty filling open positions, mostly for pharmacy technicians and front-end employees.
So a shortage of them creates shortages of getting the prescriptions filled as quickly as they normally would, and also getting vaccinations done.
13 News Now asked more than a dozen local pharmacies if they're experiencing labor shortages. Most owners said no, but they've heard of problems with pharmacy chains. CVS responded to our questions saying, "We adjust our hiring levels to meet demand, as has been the case since the start of the pandemic."
Pop-up problems that could be happening in the community pharmacies would be magnified in the chain. So waiting a little bit longer for that prescription, waiting a little bit longer to get that COVID vaccination.
Unlike other industries, pharmacies are in a tough position to counter labor shortages. If pharmacies raise wages or benefits to attract workers, they can't in turn pass rising costs onto customers because prices are controlled by pharmacy benefit managers.
There's no ability for the pharmacy to say, hey, I just increased wages by 10%. I need to increase that price by 10% because the insurance companies decide what the pharmacies get paid.
And within 2 weeks, health officials are expected to encourage COVID-19 vaccine booster shots for millions of Americans. Hoy says data shows most Americans prefer the convenience of getting a shot at a familiar pharmacy, so pharmacists are expecting a very busy fall.
Workforce demand is going to be high. It's going to be really high. Pack a little more patience.
But Hoy says he's confident staffing shortages won't cripple the industry.
There will be enough pharmacists and pharmacy technicians to provide COVID vaccinations and flu shots for patients.
In Norfolk, Evan Watson reporting for 13 News Now.
And a Walgreens spokesperson told us since the start of the pandemic, Walgreens has made adjustments to support staffing needs of pharmacy teams. This includes increasing budgets for pharmacy operations and training.